Good afternoon and welcome to our webinar today. Today I'm pleased to introduce Dr. Etan Spira. He is a gastroenterologist here at Jersey City Medical Center. Just in terms of his background, he completed his medical education and internship at NYU Langone and his residency there as well. And he also completed a fellowship at Montefiore Medical Center. His specialty is gastroenterology, and I am pleased to introduce Dr. Spira. Dr. Spira?
Thank you, Stacy, for that very kind introduction. It's a pleasure to be on this call to talk about the importance of preventative colon cancer screening. March is Colorectal Cancer Awareness Month, so it is a very good time to be talking about this. So most of the slides today I'll be using are freely available, and all this information is freely available on the American College of Gastroenterology website. But these guidelines are shared by many other societies, including the United States Preventive Task Force, as well as the American Cancer Society. So we'll be talking about a bunch of things today, but mainly I'll be focusing on the importance of screening, who should get screened, the process by which you can get screening for colon cancer, then sort of what happens afterwards. So why get screened? And the reason for that is you can prevent colon cancer. So colon cancer in the US, we diagnose about 150,000 cases of colon cancer a year, and about 50,000 people a year die from colon cancer. It is the third most common cancer in both men and women, but it is highly preventable with screening. So regular screening for and removal of growths in the colon, which we call polyps, reduces the risk of developing colon cancer by up to 90% with colonoscopy, which is one of the ways that we screen for colon cancer. So while it's important to get screened for other types of cancer, the one benefit that colonoscopy has over any other type of screening is that not only can it detect colon cancer, but it can prevent it at the same time. So with one test, you're not only finding early cancer, you're actually preventing colon cancer from happening in the first place. And so just to reiterate, why is it important to get colon cancer screening? Again, you can not only prevent it, you can not only detect it, but you can also prevent it with colonoscopy. So when we find these small growths in the colon called polyps, that if left in have the chance to become colon cancer, we can remove them, and that reduces the risk of colon cancer. Screening with colonoscopy with polyp removal prevents the colon cancer before it can start. So this is a picture of the colon, which is what we are looking at when we talk about colon cancer and what we look at when we do colonoscopy. So it is the last part of the digestive system in our body. Is responsible for removing water and sort of storing waste and helping us get rid of the waste that comes from the food we eat. These are the parts of the colon, and we look at all of them when we do colonoscopy. So screening with colon cancer with polyp removal prevents colon cancer before it can start, and I'll repeat that many times during this talk just to drive home that point. So how does colon cancer start? And how does colonoscopy or other screening prevent colon cancer? So colon cancer starts usually on the left over here, small growths that are not cancerous. They come from the sort of the innermost layer of the colon, which we call the mucosa. And this is the part of the colon that we can look at and can see when we do colonoscopy. So over time, these small growths become larger and larger. They develop more mutations, and then eventually they turn into cancer. And they turn into cancer when when these growths sort of get enough mutations and they can grow into the more deeper layers of the colon. We like to prevent colon cancer by taking out these growths before they become cancer. So once those cells spread past that first layer, which is this pink layer over here, they become cancer. And again, by doing colonoscopy, we can find these growths, we see them, we find them, and we take them out. So what is a polyp? So a polyp is a small clump of cells on the lining of the colon. Most of these polyps are actually harmless. However, some of them do continue to grow and develop into colon cancer. Now, while we can find colon cancer earlier, take out these polyps before they become cancer, unfortunately, once they've grown for a large time and spread to other places, they're often fatal when found in these later stages. So while not all of these polyps turn into cancer, all cancers do start out as polyps. Another point that we'll talk about many times is that colon polyps do not usually cause symptoms, and that's because they're often small. So to find these polyps before they become cancer, you have to do colonoscopy even if you do not have symptoms, because most of the time they do not cause any symptoms until they have already become cancer. So screening by colonoscopy with polyp removal prevents colorectal cancer before it starts. So what do these polyps look like? Well, they come in many different shapes and sizes. This is just a sample of what they can look like. Some of these are actually quite large already, so some of them are quite obvious. The one in this top left is obvious. They are smaller, as you can see on the top right. Sometimes they don't grow so into these sort of broccoli-like stalks. Sometimes they're just flat, as you can see on this bottom left. And then sometimes they're actually quite hard to see. So here, while small, this is a polyp right here. It's a little bit hard to tell even at this resolution, but you can sort of see a red growth, maybe outlined by a little bit of yellow. And that is a small polyp that, if left in, has the potential to become cancer. And this is what we see when we do procedures. So we can take these out before they become cancer. And sometimes these polyps are actually quite hard to see on colonoscopy, but we have ways of looking for them, and we can find them. So you can see the colon is not a hollow tube. It has some folds, and sometimes the polyps are behind these folds. So this polyp is actually hidden behind this wall on this side over here, but we have ways of sort of the tip of the scope is pretty flexible, and we can look back on itself and make a U-turn, and you can see here, this is the scope, and then here is the polyp. So while I've talked about colonoscopy a lot, there are other types of screening for colon cancer, and I'll go into what some of the other tests are and the benefits of colonoscopy versus some of the other ones. But any screening test can find precancerous colon polyps so they can be removed before they turn into colon cancer. And while we often recommend colonoscopy, the best screening test is the one that you are willing to do and willing to get. And so this is a depiction of what we do when we do colonoscopy. So this is that picture of the colon again, which is the last part of the large intestine. When you do the colonoscopy, we insert a very thin, flexible tube that has a camera on the end of it. We go up from below, and we look throughout the whole colon. So eventually, this is the colonoscope, this black thing. Eventually, we'll get to the end and see the whole colon. And again, what we're looking for are those growths or polyps that, if left in, have the potential to become cancer, so we can see them and take them out. So this is a picture of what taking out a polyp might look like. I will say most polyps that we find are not this large. And this polyp is actually probably on its way to becoming cancer. But this is what it looks like when we see it during colonoscopy. Here we do a little injection underneath the surface to lift it up and make it safer to remove. And that's why you're seeing this blue tint here. But this is what it looks like after it's been taken out. You don't feel that when we do the procedure. You don't have any pain sensors on the inside of the colon. So even after it's taken out, you do not feel this. And this will heal up in a couple of weeks. So if we were to go back, 2 months from now, this would be all healed. There might be a tiny little scar at the site, but that would be all healed. This blue is, again, from the injection that was used to lift the site. And most of the time, we do not have to do even in this injection. In this case, this polyp was quite large, so it was the safer way to do it. So that's why it's important to get screened, again, so we can find those polyps, take them out, prevent colon cancer. But who is at risk for colon cancer? And the easy answer to this is everyone. There are certain people who are more at risk, but everyone is at risk over age 45. So colorectal cancer affects both men and women. There is a higher incidence in men, although it's not enough to say that women should not get screened. So there's about a 1 in 23 lifetime risk of colon cancer for men. That risk is slightly lower in women. It's about 1 in 25 lifetime risk of colon cancer in women. That risk has actually been increasing lately, especially in younger people. So estimates have shown that people born on or after 1990 have about twice the risk of colon cancer and 4 times the risk of rectal cancer as those born around 1950. We don't entirely understand the reasons for that, but we have reason to believe that there is some suggestion that that is due to unhealthy diet, sedentary lifestyle may contribute to some of that. So other factors that increase the risk of colon cancer are listed here. I will say that while if you have these, it does increase the risk, most of these actually don't affect our recommendations in terms of when you should start screening, which I will go into later. The one caveat to that is a family history of colon cancer and maybe a family history of adenomas may make you want to get screened earlier than the usual recommendation of 45. Other things that you can do to lower your risk of getting colon cancer are stop smoking, healthy diet. Obesity is a risk factor. If you've had your gallbladder removed, that increases your risk. Things like getting a bunch of x-rays or CAT scans or other abdominal radiation can increase your risk. And then African American race does increase your risk, but no longer do we recommend people of African American race to get screened before the general population. So now everyone we recommend at age 45. Again, the one caveat to that is that if you have a family history of colon cancer, that may change when you need to get screened. So what are the symptoms of colorectal cancer? The truth is that, unfortunately, most early colorectal cancers don't produce any symptoms, which is why it is really, really important to get screened even if you have no symptoms. That being said, if you do have some new or worrying symptoms, you should talk to either your gastroenterologist or primary care doctor about that. But again, regardless of, and that's sort of regardless of age, if you have new symptoms, you should talk to someone about them to see if you need to get screened for colon cancer. And so again, get screened. Screening means getting checked even when you have no symptoms. And again, it's mainly because most colon cancer starts off as very, very small growths that really are not large enough to cause any symptoms. So what are your options for screening when you want to screen for colon cancer? They can be divided into 2 different categories. One is a one-step screening, a test that both screens and then can prevent cancer, and that is the colonoscopy, as I've spoken about. The other tests, which are 2-step screening tests. So those are tests that are usually stool-based tests. I'll go into them in a little bit, but any of the other tests that if they're positive, all end up with colonoscopy eventually. So any of the other tests that are not colonoscopy, you get done, they're positive, and then you will need a colonoscopy to check for those growths or early cancer. The best test of these options is the test that you're going to do. So when talking about these tests, so colonoscopy is the one-step screening test. Again, it looks for growths called polyps in your entire colon using a thin, flexible tube called a colonoscope. Your doctor or gastroenterologist can then find, detect those polyps, and remove those polyps to prevent colon cancer. It is a very common procedure. It is the most common procedure performed by gastroenterologists in the United States. So we're all very comfortable performing this procedure. And then colonoscopy with removal of polyps offers long-term protection against developing colon cancer or dying from it. And again, it's great that you can find these polyps before they're cancer. That prevents the need for surgery. It prevents the need for chemotherapy, and prevents the need for surgery and chemotherapy. So that's a great advantage of colonoscopy, of colonoscopy and finding the polyps before they turn into cancer. So the other tests are two-step screening tests, and so these are usually done on stool samples. So the two common ones that are used and that are approved in this country are something called a FIT test. So a FIT test is a fecal immunochemical test that looks for evidence of hidden blood in the stool. So this is blood that you don't see with your eyes, but is microscopic and present. As polyps grow and as cancer develops, they tend to shed some blood cells, and so we can find evidence of those blood cells in the stool. This is a test that you need to do on an annual basis. If it is positive, then you need a colonoscopy to find and remove those polyps or early cancer. A similar test, which is done at home through a company called Cologuard, is a multi-target stool DNA. And this test actually has a component that's a fecal immunochemical test, but then also adds a portion that looks for abnormal DNA associated with colon cancer or precancerous polyps. It's more sensitive than FIT, but going with that, you have a higher chance of a false positive, especially as you get older. This test is a test that's recommended to be done every 3 years, but maybe possibly 1 to 3 years, but 3 years at a maximum every 3 years. Again, also, if it is positive, the next step would be a colonoscopy to look for and find those polyps and remove them. The benefit of these tests over colonoscopy is that colonoscopy does require you to drink a liquid to clean out the colon so that the camera is able to look around and find polyps. These tests don't require that. These tests can be done at your home, in the privacy of your home, by submitting a stool sample. And then with a FIT test, you're either returning that to your doctor or the lab with the stool DNA, the Cologuard that's done through the mail. You're sending it back to this private company, but you do have to collect the stool sample and send it in. So those are the main recommendations for screening in this country. There are other tests that you can do if you don't want to do a colonoscopy or if you don't want to do the stool sample. Those include a CT colonography, which is a CAT scan, which looks for these small polyps or growths in the colon, or a colon capsule, which is a pill, a camera pill that you would swallow that also would look for polyps in the colon. Again, it is any of these tests that find these polyps, you need a colonoscopy afterwards to remove those polyps. Unlike the FIT test or the multi-target stool DNA test, you do have to drink some prep for the colonoscopy and colon capsule, similar to the colonoscopies. The benefit is that you don't necessarily need the anesthesia, sedation for the procedure. With the CT, you do need to get a imaging, so that that is a radiation exposure. So there are benefits to each of them if you're unwilling to undergo the other tests. But I will reiterate, compared to colonoscopy, all the other screening tests do require a colonoscopy afterwards if they are positive. And so this just goes over what we spoke about again. So the one-step test is the colonoscopy. Your gastroenterologist can find the polyps, can remove the polyps all in one step. With the two-step tests, again, you're either doing a stool test at home, sending it in through the mail, or you're doing an imaging test with this, which is a CT colonography or a colon capsule. If any of those tests are positive, then you're ending up with colonoscopy. There is one here that I did not mention, something called a flexible sigmoidoscopy. That is actually very similar to a colonoscopy, except you're only looking at the very end of the colon, not the whole colon. So if that is positive, then you actually then have to go ahead and do a colonoscopy anyway to look at the rest of the colon and make sure there are no polyps in the other portions of the colon. So who should get screened in terms of age? So as we spoke about, really everyone should get screened, even if you have no risk factors. Unfortunately, even though there are things, family history does increase your risk of colon cancer, most colon cancers in this country are diagnosed in people who have no family history. So many of the societies at this point recommend colon cancer screening in average risk individuals. Those are people without any family history of colon cancer between the ages of 45 and 75 to reduce precancerous growth, advanced adenomas, reduce colon cancer, and reduce death from colorectal cancer. Depending on the test you choose, you have to get it done more or less frequently. So that if you're doing colonoscopy and it's a negative colonoscopy, you only need one of those every 10 years. The other tests, the FIT needs to be done every year. The multi-target stool DNA needs to be done at least every 3 years. And then after age 75, between age 75 and 85, that's a decision to talk about with your doctor, gastroenterologist, about whether it makes sense to continue looking for these polyps or colon cancer. But up until between age 45 and 75 is recommended for everyone. Between 75 and 85, that's a discussion to have with your doctor. And then regarding what tests you're going to get done, again, you can, if you're hesitant about getting a colonoscopy, you can talk with your doctor about some of the other screening options that are available, including the FIT test, the multi-target stool DNA, the CT colonography, or the colon capsule. In terms of what are recommended for the American College of Gastroenterology, it's either a colonoscopy every 10 years or a FIT every 1 year. Those are the preferred screening tests to have done. If those are not used, then other tests that are done and other tests that we've spoken about, again, are the multi-target stool DNA, the flexible sigmoidoscopy, the CT colonography, or the colon capsule. Those have to be all done more frequently than the colonoscopy, even if they're negative. Now, the one thing that is not recommended is a blood-based test for colon cancer screening. So this slide is important, but it's actually not as important as it was a couple of years ago because we've moved the age of screening for everyone from 50 to 45. It used to be that just for African Americans, we started at age 45, but the risk is high enough in all ethnic and racial groups that we've moved that age to 45 for everyone. Okay, and then just if you have a family history, it may be important to get screened earlier than 45, and that's a discussion to have with your doctor or your gastroenterologist. And oftentimes, the screening has to be done more frequently. Occasionally, depending on your family history, it may make sense to get genetic testing to see if you have a genetic mutation that may predispose your family to colon cancer. And so how to get a colonoscopy scheduled. So if you'd like a colonoscopy, you should talk to your doctor to refer you to a gastroenterologist. In many places, you can actually get scheduled for a colonoscopy. It's called direct referral colonoscopy without actually having seen a gastroenterologist. This is a website that will show the GI.org, which is the American College of Gastroenterology website, will let you find a gastroenterologist anywhere in the country. However, for those at Jersey City, it probably makes more sense to use this rwjbh.org/colon screening website, which will give you a list of doctors who do the procedure at Jersey City Medical Center. And this is the number to call, 973-200-7844. And this is, again, that website and that number. So you're only 45, you still need a colon cancer screening, no matter how healthy you are. So again, it's important to get screened, take control of your health, make a plan to talk to your healthcare provider about colorectal screening, and don't put it off. Even if you don't want to get a colonoscopy, the most important thing is to get screened. There are other options, the stool tests, the CAT scans, the capsules, whatever it is you're comfortable doing, it is important. The most important thing is to get screened. And so these are the common reasons people give for not getting screened. So I'm healthy, why do I need to get screened? Unfortunately, we don't know. Everyone is at risk for developing colon cancer. You often don't have symptoms of colon cancer until it's too late. So by getting screened, we can find those polyps in an early stage and remove them before they become cancer. No one in my family had colon cancer. Again, unfortunately, most colon cancers are diagnosed in people who don't have a family history of colon cancer. And roughly 5 in 100 people are destined to get colon cancer in their lifetime, even if they have no family history. Only men get colon cancer. That is, well, men have a increased risk compared to women, a slightly increased risk. That actually a fairly equal opportunity disease, and women have a very similar risk as men. And then I have no risk factors. The biggest, most modifiable risk factor that you can do to prevent getting colon cancer is getting screened. So getting screened reduces your risk of colon cancer more than doing anything else, even if you don't have any other risk factors for colon cancer. And I'll leave this up so that anyone who wants to can sort of take a look at this website while we take questions.
Thank you, Dr. Spira. That was really great. We have just a few, I think there's 3 questions we have. The first is, we noticed that you shared a picture of the polyps that you could barely see that they were there.
Yes.
Would those still need to be removed even though they're barely visible?
So yes, I will say that again, that not all polyps become cancer. Unfortunately, we don't know just by looking at them which ones are going to become cancer or not. Once you're getting the colonoscopy, you don't feel, when we take out those polyps, you don't feel it. You don't have any pain afterwards. There are no pain sensors there. So because we don't know which of those polyps is eventually over the years going to grow and grow and grow and become cancer, if we see them, we take them out. And it doesn't really change how you feel afterwards or really any of the risks afterwards, especially small ones. We can easily take out without any problem.
Thank you. The next question is, we saw the image of the route that the colonoscope takes through the
Yeah.
intestines, or
Mhm.
through the colon actually. How long does that procedure typically take?
So the whole procedure is actually quite short. I would say no more than 15 to 30 minutes. Um, Occasionally a little bit shorter than that,
Hmm.
but probably around 15 to 20 minutes is a very common time for the procedure. Um, so it doesn't take long. We can actually get the scope to the end of the colon fairly quickly, and then we spend most of our time just coming back and looking for those, carefully looking for the polyps. That's where most of the procedure time comes from.
That's not long at all. That's helpful.
Yeah.
And last question is, how often should a person who's 50 plus, how often should they be screened or receive a colonoscopy? We noticed that your slide said every 10 years, I believe, but should it be more frequently for a person who's 50, age 50 or more?
So not so much the age, but it depends on what we find on the colonoscopy. So that every 10 years or the recommendation for the colonoscopy is if we find no polyps at the time of the procedure. So if we go in, we don't find any polyps, the risk of us missing a polyp uh, that will grow into a cancer in 10 years is very, very, very small. Um, if we do find polyps during the procedure, those recommendations change. And it changes based on the number we find, how large they are, exactly what type of polyp they are. So that can be reduced really anywhere up to a year, but oftentimes, even if it's reduced, it's 3, maybe to 5 years later. Um, and that's going to depend on what we find during your procedure.
Thank you, Dr. Spira. Are there any other questions for the doctor? We have about 8 people on listening to your talk today, Dr. Spira. So I want to make sure that they have time to
Sure.
direct any questions to you. This was very informative.
Thank you.
Are there any questions from our audience for the doctor? Looks like we have no questions, Dr. Spira. It was very informative.
Thank you. And I'd like to thank everyone for coming and listening. And again, just get screened. Whatever method you choose, just get screened. We have the website and the number to call, which makes it very easy to do.
Thank you. Thank you, Dr. Spira, and thanks to all for attending today.